Hello, everyone. My name is Tom Bergen. I'm the Healthcare Marketing Director for Essity Professional Hygiene, makers of the Torque brand. And today, together with my colleagues Ruben Gaspiek and Marcel Kolkman, we're going to talk to you about how data-driven solutions support better hygiene and efficiency in healthcare cleaning. For those of you not familiar with Essity and Torque, Essity is a leading global hygiene and health company. We're dedicated to improving well-being through products and services that are essential to everyday life. And our Torque brand comprises a complete line of hygiene products, services, and tools designed to help companies and facilities better hygienic outcomes. Torque also offers digital solutions, such as Internet of Things sensor technology that enables data-driven cleaning. Torque and Essity have been proud participants in Clean Hospitals since 2019, and we are excited to be part of this important dialogue today on how we can improve hospital hygiene moving forward. Hospital hygiene is not anything new. The importance is always there, and it's been a big key focus. But with the pandemic, the overall awareness of hygiene is changing and growing. In a recent Essity survey, respondents were rather clear. Their expectations on cleanliness and hygiene are higher, particularly for hospitals. Interesting too is the journey and evolution of cleaning itself. As societies and facilities have developed, new cleaning tools have developed with them. However, the next big leap in professional cleaning is not a tool that we're used to thinking about. Rather, it's something that helps you make more out of the resources that you already have. Welcome to the era of data-driven cleaning. Everything from coffee machines to washroom dispensers are being connected to the internet. Yet the value lies not in the connectivity itself, but in the actions you can take based on the information provided. When cleaning teams and their managers get real-time data about the cleaning needs, the very logic on how cleaning is done changes. It becomes possible to stay ahead of the game, to do exactly what is needed, where, and when. This data-driven cleaning, handling a complex facility like a hospital, is transformed from being a frustrating guessing game into a fact-based precision event. With that, I'd like to introduce my colleagues, Marcel and Ruben, on how data-driven solutions support better hygiene and efficiency in healthcare cleaning.
Hello, and thank you for joining this session on how data-driven solution supports better hygiene and efficiency in healthcare cleaning. My name is Marcel Kolkman. I'm Key Account Manager for Torque and Essity brand.
Hi, and my name is Ruben Gaasbeek. I'm the Hygiene Advisor, also for Torque. Thank you very much.
Take it away, Ruben.
So today we are going to take you through some subjects of how data-driven solutions can help you in a better efficiency in healthcare cleaning. First, we will talk about the optimized efficiency. Then we will take you through how to increase your hygiene and quality. And last but certainly not least, how to empower your team. During this COVID-19 pandemic, this has added more pressure on the cleaning services, especially now with all the complicated wearing of PPEs staff has to do. The Essentials Initiative survey showed that 70% have a higher expectation of the hygiene standards within the hospitals since COVID-19 has broken out. And this brings us a couple of challenges. The first challenge is generating operational efficiencies. A top priority is getting the work done, or even more work done, in the same amount of time and managing the costs. The second challenge is hygiene. Hygiene has always been a given standard in healthcare. And third, but not least, is the cleaning operations are challenged by the high levels of staff turnover. Consequently, facility managers struggle to ensure cleaning quality and must invest a lot of time in recruiting and constant training and retraining. This is compounded by the fact that cleaning is shift-based work, meaning frequent shift changes and hands-offs make it harder to account for responsibilities. How can you increase your efficiency in keeping the high quality of cleaning standards? Well, this is how data-driven solutions comes in. The way we used to work is no longer valid anymore. The approach we used to have are no longer enough. Marcel will show you how it can be done. Marcel.
Thank you, Ruben. Okay, I would like to take you to a trip, what we call data-driven solutions by Torque. So the solution is what we call data-driven cleaning. And let's take a little bit more deep dive in what we've highlighted as a challenge. In this case, the efficiency. We aim for more efficiency by making sure that the cleaner knows exactly what to do at what time, which means he doesn't open and close dispensers that don't need refill. It's a waste of time. The cleaner does not visit a location which has no visitors in between cleaning. This is quite important because what we do in standard is we focus on frequency-based cleaning. And this is a preset number of cleaning rounds with a preset number of dispenser checks. So when we do what is necessary and when it's necessary, we see that cleaners find more time. As a matter of fact, when we ask our customers, 82% of our customers claim that they have increased their efficiency in some way. Either it's making sure that they have less complaints, or they have better efficiency in terms of number of cleaning rounds, or just simply not opening and closing 90% of their dispensers due to the fact that they know where it's needed. So, making sure that you have enough product and clean and refill at the right time will help you to increase your quality and hygiene. That's the second challenge. Let's take a better look at what we see at our customers. For example, this is a customer where we show a graph of a customer who had sensoring in the dispensers, but they didn't use the sensors yet. They didn't use the data. So we measured the number of dispensers multiplied by the number of minutes that the dispenser is empty, and it was a result like this graph. It shows a lot of empty dispensers, a lot of empty dispenser time, and it's basically every day. So frequency-based working is not sufficient in making sure that you have your dispensers equipped all the time. Then we started training the customer, in this case the cleaning staff, and all of a sudden you see a firm decrease of number of dispensers that are empty. So the empty dispenser time has dropped significantly. As a matter of fact, on average, our customers have 85% less time with empty dispensers, which is great. And then, of course, the challenge about making your cleaning staff engaged, keeping them happy, keeping them on board. It's very important that they get recognized for what they do and recognized for doing the right thing at the right time. Data-driven cleaning will absolutely help them doing the right thing at the right time. The sensor will provide the right information for the cleaner to be present at the location where it's actually needed. And when we ask customers who work with Torque EasyCube, how it's received by the cleaner, by the cleaning staff, we always get feedback that they are very happy, that they are working with a system that really makes sure that they don't get complaints and they do work that is very useful. They don't do repetitive work, they do where they are actually required to clean. So not only we are helping the customer and the cleaner to work with a data-driven solution, but we also, in addition, have a Torque training package, including a presentation on cleaning strategies, and it's downloadable from Torque Online. Torque Interactive Clean Hospitals training trains you and your staff interactive in daily cleaning and discharge cleaning. It is available in more than 20 languages, and you can adapt it to your healthcare facility. So, all in all, the data-driven cleaning helps healthcare facilities to overcome both long-standing and new challenges. Long-standing challenges in terms of efficiency, making sure that your staff gets motivated, and new challenges in terms of increased hygiene, expectation by the customer. And we have proof of evidence. We have multiple hospitals within the Benelux already using Torque EasyCube sensoring. For the main reason, to increase quality, to make sure that their staff is actually living up to the expectation of the customer. So, it's very important, if you want to embrace change, embrace data-driven cleaning. It helps you to optimize your efficiency. It can and will increase your hygiene and quality when using the system. And it will empower your team. So, as a summary, and to give a quote of Darwin, it's not those who are the strongest that survive, but those who are willing to adapt to change.
Thank you very much for your attention. So are you the one who is willing to adapt? We will answer all your questions in the next Q&A. Thank you very much.
Thank you.
Thank you, Ruben and Marcel. I hope you enjoyed our session on how data-driven solutions support better hygiene and efficiency in healthcare cleaning. In closing, and before we open the floor to questions, on behalf of Essity and our Torque brand, we'd like to say thank you to all the healthcare professionals and cleaning teams for keeping our hospitals clean and ready for care. Thank you again, and let's open the floor to questions. Hello, everyone. I'm Tom Bergen. If you have any questions, please feel free to ask here in the chat or to ask. And while we're doing that, we had a bit of a scheduling challenge today. So I'm joined by a few other colleagues, and I'll ask them to very briefly introduce themselves. So Malika, if you'd like to introduce yourself.
Yes, sure. Thank you. So I'm Malika Vyas. I am the key account manager for our digital solution that we offer, Torque Vision Cleaning, and I'm really happy to answer any of your questions.
And Jenny Logenis.
Yes. Hi, everyone. My name is Jenny Logenius, and I'm a global brand manager for hygiene at Essity. I'm also happy to answer any questions if you have any. And right now, I don't see the questions here, but
Okay.
Give it a few seconds more.
While we're waiting for any questions to come in, I would just like to kind of highlight, linking back to some of the things that were discussed earlier today in the opening sessions about how there are, it's more than just the cleaning evolution itself. It is about the risk assessment. It is about the product selection, and it is about the processes and training and the assessment of the quality of the work. So it truly is a multimodal effort. So with data-driven cleaning, what we're trying to do and what we're doing is empowering the teams to basically work smarter. That's going to be a twofold effect. There's going to be an efficiency gain, and ideally then a satisfaction gain, and freeing up time to hopefully allow them to do more time in the critical task of infection prevention. Part of the cleaning team's challenge is not just the care areas, it's also those public spaces, the lobby, the main floors. So anything we can do just to make their workflows more efficient in those areas, we could obviously free up time and resources to focus more on those more critical care areas, or those areas that we deem more of an environmental challenge based on the risk assessments.
Yeah, I think it was crystal clear because we can't see the questions here.
If there are no questions, we are here in our booth virtually throughout the entire event, and happy to talk to you one-on-one about both Torque Vision Cleaning, but also talk to you about training and education programs for cleaning staff.
Now we have a question here. Any new evidence regarding the non-touch cleaning technologies? Very good question.
Real good question. That is not something we focused on within our space just yet. And I don't know if Jenny, you have anything to add to that, or Malika, I know we can probably add any sort of tasks or any sort of processes to within, digital cleaning plans and such to help teams with that, but we don't have any evidence regarding non-touch that I'm aware of.
No, not at the moment. And this is an area that we are looking into, though, I would say.
Yeah, same here. I mean, for digital solution as well, non-touch cleaning is not a part as yet. But of course, with the digital solution, you can absolutely have an overview of what kind of dispensers are available, etc. So there will be less direct contact. And I believe the technology here, what we have, that is on its way. And maybe we come up with something new in the future.
Yeah, and I don't know if everyone in this session was able to attend the earlier session this morning, but definitely, we need to remember that non-touch, disinfection or that sort of thing is really an add-on to the overall cleaning and disinfection effort. Making sure surfaces are clean before then we can do the proper disinfection. And then a lot of the current non-touch systems, being aerosols or be it UV and the like, can be add-ons to that. But we need to make sure that those surfaces are clean prior to that.
Yeah, we got an extra comment here on hydrogen peroxide vapors as an example. So,
yep.
Yeah. Then we have another question. Does it apply only on dispensers, or can we do quality control and hygiene routes?
Yes, of course. So with the help of the digital cleaning plan that is available and it's a part of the system, you can make different kind of tasks for the cleaners, so they exactly know what kind of controls they need to do, what kind of hygiene products they need to use, which chemical to use for which region. So absolutely, in the digital cleaning plan, you can set up all your tasks, and it's also very helpful for the cleaners because every day they have different challenges, different tasks, something that comes up on a special request, and for them to remember everything and make sure that their standards are maintained is a very big challenge. So the tool, definitely the digital solution, helps them in every step.
Yeah. Very good question. Okay, I think that was all. So
I think we're close to the end as well. Again, if anyone would like to talk to us one-on-one, we'll be available via the chat or in our virtual booth. Thank you guys so much for your time and attention throughout this session, and looking forward to a good rest of the day.
thank you.
Thanks, everyone.
Thank you very much to all. Thank you. Goodbye.